Today's Wednesday, October 9th, 2024. We just had a lunch and learn a few minutes ago, and I want to thank everybody who joined us for lunch and learn. It was a great opportunity for the community to meet many of our providers and hear about a lot of the processes going on at Titus Regional Medical Center. So for all of our team who joins Lunch and Learn on a monthly basis, thank you for joining us. And we talked a little bit about this topic this morning, but we wanted to come on to do Facebook Live and just update the community. As you know, when things happen from a health perspective and health outcomes perspective, we like just to update Mount Pleasant, Titus County, and our 4 surrounding counties so you're not surprised by any impact. Over the last few weeks, we've seen some terrible storms in the Gulf and on the East Coast. Many of these storms have caused flooding in many areas, especially in North Carolina. One of the things that's come out of that since October 1st is the flooding of one of the plants that produces a large portion of the IV supplies for the United States. In North Carolina, a company named Baxter has their manufacturing facility, and they produce on a daily basis 60% of the IV supplies, the bags, the bottles, the syringes, everything associated with IVs. Now, we think healthcare. You almost always think about this visual right here. The bag, the IVs, the IV pumps. And those bags don't seem like a lot, but in reality, the supplies chain is very small and very limited. And 2 or 3 providers across the nation are the ones who supply to healthcare systems. So with 60% of the supply now shut down, it's become an emergency in many healthcare systems. You've probably seen it on the news. You probably saw it in the Dallas Morning Paper this morning or in other avenues that you've seen. And we just wanted to make sure that you knew that Titus Regional Medical Center is impacted. We're no different. Baxter is our major supplier for IV supplies. But I want you to know what's going on. We have a team here at Titus, and we're very grateful to our clinicians, our providers, for all the work they've done. Kathy Griffiths, our Chief Nursing Officer, which many have seen in our presentations, Lunch and Learn, and other things. Dr. Hooks, our Chief Medical Officer, and then Ruth, our pharmacist here at Titus, have been working tirelessly over the last 10 days to monitor the situation, and as it's increased in risk and increased in impact, trying to make changes across the health system. I want to make sure the community understands TRMC is providing the care for emergencies and urgent care needs on a daily basis. That will not stop. But we want to make sure you also know that we're taking high conservation actions against this risk to reduce or mitigate this shortage and the impact it will have. So the team that Kathy, Dr. Hooks, and Ruth have combined have looked at many different ways to reduce the need for IV supplies and when needs the IV bag and when other medicines and other therapies can be used. They've been very creative. Just like in COVID, when the providers and the clinicians came together at the table, we're seeing the same thing right now during this nationwide IV shortage. The ideas that are coming back and people are creating at all levels and bouncing off each other and running by our team have been amazing. So to the team at Titus, thank you. Kathy, Dr. Hooks, Ruth, Mary in surgery, Patty, all the physicians that were contacting, all the nurses and department managers and leaders, thank you. The work you are doing is impacting the health of our community. And we wanted to make sure our community knows. We are canceling some elective procedures that will be high IV impact things that can wait a day or 2 or a week or 2. Emergency and urgent care is not being impacted. However, we will be selective on surgeries in the next few weeks, and we didn't want anybody to be surprised. If you had a delay by a week or 2 weeks on an elective procedure because of the risk for IVs, we just wanted you not to be surprised and wanted you to make aware. Our goal at Titus Regional Medical Center is to be transparent. We want to make sure you understand what's going on in the health system. And right now, this is one of many things that are going on in healthcare, but it is impacting us here at Titus. We don't know when the shortage will be complete. We're in daily contact with our purchasing groups, with the Texas Hospital Association, with the American Hospital Association, with the Texas Rural Community Hospital Association to really mitigate these risks, but we just wanted to make sure you were aware. Please update us. Please reach out to us, and we'll be more than happy to keep you updated, and we'll continue to put out posts and press releases as we get more information. We believe we're going to be fine, but we don't want to do anything and have a surprise to our community. So we'll continue this update process, and hopefully in a day or 2, I'll be able to get on and let you know. But with that said, we're also following some severe storms in the Gulf today, and the impact those storms may or may not have in North Carolina as well. So we're preparing for the worst. and we're hoping for the best. And we want to make sure we continue to work that. So to the team at Titus who's been leading this, Kathy, Dr. Hooks, Ruth, thank you. It's been a blessing to watch you guys in action, and we're very appreciative of the work. To our friends on the East Coast, and our friends in Florida, and the millions of people who will be impacted by the storm that hits tonight, the floods that have already happened, and the floods that may come for the next few days, please know there's at least one family praying for you. And there's many people at this health system who are praying for you. And we're praying for safety. We're praying for your needs to be met. And we're praying for no more damage to people who have already been impacted by these horrible storms. God bless you. We're praying for you. To the community of Northeast Texas, thank you for your support. And we appreciate what you do for Titus Regional Medical Center. God bless.